Every day, hospitals and health systems across the country respond to the trauma caused by gun violence. According to CDC data, more than 100 Americans die each day at the receiving end of a bullet. In addition to the pain and suffering it causes families and entire communities, gun violence has a significant healthcare dimension as well. Hospital and health system leaders have a unique voice to lead initiatives to reduce the risk for violence and advocate for advancing health. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, senior writer for AHA. The AHA's Hospitals Against Violence initiative has developed and curated resources and insights to help combat the public health threat from guns. This podcast is one of them. Today's, the first in a series on the topic, is titled Gun Violence Research: What Comes Next? Our guest, Dr. Megan Ranney, is an associate professor of emergency medicine and a practicing emergency physician and researcher who focuses on the intersection between digital health and violence prevention. She is also the chief research officer for the American Foundation for Firearm Injury Reduction in Medicine, or AFIRM, the nation's leading network committed to reducing firearm injury through the public health approach. In addition, Dr. Ranney is the director and founder of the Brown Emergency Digital Health Innovation Program. And Dr. Ranney, with that long build-up, thank you for coming on the podcast today.
Thank you for having me. It's an honor to be here.
Well, why don't we begin by talking about AFIRM a little bit, and please tell me why it was created and what it hopes to do.
Absolutely. So AFIRM was founded in 2017 by myself and another emergency physician, Dr. Christopher Barsotti. We founded AFIRM in 2017 after years of work with medical societies, researchers, victims and survivors from across the country to try to create a health-based approach to gun violence prevention. We created this organization in response to a series of difficult clinical cases and national tragedies, as well as into response to the lack of, at that time, a public health response to gun violence on a national level. We knew together that there was a better way forwards, that we could move beyond the political stalemate that our country was caught in 2017 when we created AFIRM, that we could move beyond the gun control versus gun rights debate and towards a new focus on prevention. We felt that we could do this by creating data and evidence or research, but also by sharing clinicians' stories and creating a community that stood for prevention, regardless of where we live or who we are. We had watched the country get stuck, right, in the same old debate. Many of us were activated after Sandy Hook to try to do something different. And I think that many of us also, by the time 2017 rolled around, felt a little hopeless. By creating AFIRM, we tried to say that there is hope, that we can prevent gun violence the same way that we've done for car crashes or HIV or polio, that we can bring that medical approach to epidemics to gun violence as well. We are a 501c3 funded by individual donors who have the goal of changing the conversation, enhancing evidence and knowledge, and then implementing that knowledge quickly to help save lives. We're proud that in the last 2 years, in collaboration with all our partners, we've really created a new path forwards, whether it was the This Is Our Lane movement or the, I know we'll talk about later in the podcast, about whether it's the recent research funding from the federal government or any of the community level initiatives that we've helped lead.
I would suspect that AFIRM's approach will come as welcome news to a great many Americans who have differing opinions about the gun issue, but feel like that the debate has been stuck in the same groove again and again. And now you're coming at it from a new angle, leading the development of a research agenda that advances a public health approach to this subject. What important information would you like to share with hospital leaders and other professionals that you've learned so far? Any messages to send out at this point?
Yeah, so the first and most important thing, as you alluded to, is that there is hope and that we are creating progress that is independent of individual politics or policy. There's a lot that we as healthcare professionals know already, and that we can do already to reduce gun injuries and deaths in our communities. So at Affirm, we're working to improve implementation of what we know at the same time that we're creating data on what we need to do better. The second big thing that I hope that hospital leaders and other professionals learn or take away from this podcast is to know that in order to create change, we first have to understand and share the facts about gun violence. Facts like, as you mentioned in the introduction, 100 people die across this country every single day. 2/3 of those deaths are suicides. 76 women are shot and killed every month by a domestic partner. And lastly, gun death rates are incredibly similar in urban and rural communities. So although we may think of gun violence as being something that touches one population, this is actually something that touches all of us. And as healthcare professionals and leaders, we can help articulate that and help get our communities on board with the importance of prevention. The third thing that I hope that listeners to this podcast take away is that it is possible to actively redefine the way that we approach this problem. One of the beautiful things about research is that it's based on data and hypotheses. And I can tell you that there is a large network of researchers, public health professionals, healthcare providers from across the spectrum, ranging from nurses to social workers to trauma surgeons to psychiatrists, who are completely committed to gathering and then disseminating accurate data on how to fix this. One of the things that I'm so proud of about Affirm is that we've merged this data-driven approach with a true grounding in the community, because ultimately, as all of us as healthcare providers know, each community is experiencing and dealing with firearm injury and firearm injury prevention in its own way. But the data also supports that the underlying philosophies of public health, of preventing injuries before they happen, is going to be the same in every community. Ultimately, our screening and our interventions need to be based on respect for patients and a harm reduction approach, as well as a connection to local resources.
So has it been your experience that framing the gun violence issue as a public health issue as opposed to a constitutional rights question is something that opens people's minds to new information and possibly new solutions?
Yeah, absolutely. And I'll actually mention here that my co-founder, Dr. Barsadi, is a firearm owner and rifle safety instructor himself. He and I, like most physicians, nurses, respiratory therapists, physical therapists across the country, have had horrific cases of gun violence that we've taken care of. We have also, like many of us across the country, had cases where we know that we made a difference in preventing a future tragedy. And when you can come at gun violence from that perspective of prevention or public health, you can then identify risk factors, right? You can intervene on those, and you can talk about the things that we need to do for high-risk groups that make sense to everyone. Because at the end of the day, whether we are firearm owners or not, whether we live in a red state or a blue state, we all want to see our kids and our families and our communities safe. Now, we didn't take away cars to make the roads safer, right? We put seatbelts in place, we put airbags in, we changed the design of roads, we educated people about drunk driving, and when we apply the public health approach to gun violence, we can do the same thing. We can use those same strategies of science and injury prevention to help create change, again, in a way that goes beyond politics and instead is grounded in the evidence-based approach that all of us in medicine hold dear.
To switch this to a discussion of what federal action can do for a moment, the federal government recently appropriated funds for some gun violence research. What do you read into that, and what do you expect to come out of it?
So most of all, I am just so unbelievably excited about these appropriations. They are long overdue and a really critically important first step. So I am going to take a step back for listeners who aren't familiar. You have to understand that for the past 23 years, since the infamous Dickey Amendment was passed in 1996, the field of gun violence prevention research has been woefully underfunded. There was a study in 2017 that reported that overall federal funding for this issue was less than 2% of what would be predicted based on the mortality burden. There's another study that I and co-authors Cunningham and Carter wrote this fall that showed that funding for pediatric firearm injury prevention was only about 3% of what would be predicted, despite the fact that firearm injuries are the second leading cause of death for kids across the United States. So because of those funding restrictions, we have a whole generation of researchers and research that hasn't happened. We have a lot of catching up to do. So this money is unbelievably important, but it's equally important to make sure that those funds are continued, not just this year, but in future years, and hopefully even augmented to help us address gun violence on the level that is needed, commensurate with the burden of injury. Now, what are we going to do with these funds? There are countless research agendas already out there, and I'm happy to share those with you if you want to put them in the show notes. There are an awful lot of questions because of that consistent underfunding that we have yet to answer. But in order to get to those answers, we also all need to keep being vocal about how this is an issue that needs research and needs all of us.
Final question, how do you assess the climate right now? Obviously, we live in polarized times, to put it mildly, and people disagree deeply on some major issues. How do you see gun violence and the need to address it fitting into the national dialogue, maybe as an issue to the electorate this year? How do you handicap the odds of making some progress on this issue?
So I have more hope now for making progress than I have ever had. Now, will that progress happen on a national level? As you allude to, right now, I don't have an awful lot of hope for there being a lot of progress in Washington, although I would love to be pleasantly surprised. I do have a lot of hope for our doing national level work through organizations like AFIRM or AHA or other groups that have partnered with us, where we take the current evidence and implement it on a community by community basis in a way that really reframes the way that all of us approach gun violence prevention. I think we have a body of knowledge which can inform that work, and we all have our community connections that allow us to do this in a way that is, again, respectful, but also effective. So I have tremendous hope. I don't see this being an issue that goes away in the short term. I think that every day, we're recording this today, there was just another major shooting yesterday in Seattle. And there's rarely a day where there's not something that crosses the news. Never mind the dozens and dozens of deaths that never get reported. So I don't see this as being something that disappears, but I do see this as being an area where I finally have hope, where I see the work that I and my fellow folks at AFIRM and other people at organizations and at universities across the country, we've all been working on this for a long time. And I see our work starting to bear fruit, and I anticipate that in the next few years, we'll start to see a decrease in the number of gun deaths, and then hopefully a decrease in the fear and the other long-term consequences for patients and families and communities that we're currently living under.
I certainly hope you're right. That's a nice positive note to end on. Anything else you would like to share, final thought with AG podcast listeners before we wrap up? Anything that we haven't had a chance to discuss so far?
Yeah, that's a great question. I think, for those that are listening that are interested in learning more, I would certainly welcome you to check out our website at www.affirmresearch.org and feel free to get in touch. Like I said, we're working with folks across the country to help implement change in individual communities, and I'm always happy to talk to people. I think the only way that we're going to fix this is through a laser focus, again, both on data and research, but also on engaging each of our individual communities. And so I really appreciate the listeners of this podcast who will take a minute to help make that happen in their own hospital system or locale.
Dr. Megan Rainey, thank you so much for joining us and being on AHA's podcast today and sharing your insights. Thank you very much.
Thank you.
If you'd like to learn more about the work that hospitals and health systems are doing to prevent violence, visit us at www.aha.org/preventviolence.